So one of my favorite books that I have read, Spiritual Midwifery by Ina May Gaskin. It is a wonderful book. I really felt so confident in my in birth once I read it that, I mean, there's nothing that can stop me. I feel like I could birth my own son and I don't need the help of anybody. Like, I could do this by myself. And it's a natural thing, you guys. I know some of you are going to watch this and you're going to think you're crazy. How do you birth your own child? Like, I've seen the movies. I've seen, you know, what can go wrong. And I've seen just, you have to go to hospital. You can't do this on your own. You're crazy. But you can. You don't need all the interventions that hospitals give you. All you need is to trust your body. That's really all you need. Now, some people, yeah, they have complications. There's some things that we can't avoid, and you do need to go to the hospital. But if you want to feel so confident in yourself that you can do this by yourself, and you just want to learn about birth before you go to the hospital, I would say this is the best book for you, because it teaches you how to be your own midwife. This is kind of like a guide to being a midwife. So it tells you everything. Let me show you some pictures. The stages of birth. It shows you the stages of where, you know, the baby is and how it's going to come out. Clamping and cutting the cord. Like, I'm serious. This teaches you how to birth your own baby. Like, what to do once the baby is born. Tending to the baby. And it tells you everything that you need to do. So it teaches you, check his general appearance, check for breathing, and then it tells you exactly how to do that. Check the pulse, and it tells you where the pulse should be. Take the baby's temperature, where it should be. Like, literally, you can have a baby on your own. And I'm not saying that you should do that. I'm just saying, read the book. However you feel about everything, you make your own decisions. I mean, it tells you everything. Okay, I mean, this book is flippin' awesome. How to check the pulse of the baby. That's a cute little picture of a little boy. It talks to you about postpartum depression, and it's not just a paragraph like it is in most of the other books that you read. Look at this. A lot more than what you see in the other books. And it tells you, you know, how it can lead to that point and what you can do. It tells you how to you know, what happens when you tear, and you know how to apply local anesthesia to like fix it all. Some of you are going to be thinking, like, if I rip, I'm not going to, you know, sew myself up. No, you're not going to do that. But if you go to the hospital for your birth, or you go with a midwife, or you have it at home, you'll know what's going on. You'll know what they're doing to you and why they're doing it. It talks about episiotomies, which is when they cut you. And so you'll know what medicine they're giving you. That way you feel comfortable. But knowing what exactly is going on and what they're doing to you, I think that's important. I don't know about you, but I think that's it talks about laboring mothers as an elemental force. The state of consciousness of a woman during birth, and how you really need to be relaxed completely, and you need to pay attention to your body and what's going on in order for you to get through the birth easily. Because the more you are not relaxed and you're not comfortable with yourself, the less likely that you're going to open. Your cervix is a muscle. It's a muscle that's thinning up, that's opening up. And like any muscle, if you're tense, it's not going to open up. It's going to stay like this, you know? So you need to be relaxed. And one of the reasons why I'm not going to hospital is because if I have different nurses or one nurse coming in every hour, putting her hand in my vagina and checking me every hour, and you know, this is a lady I don't know. She's not my doctor, and most of the time they don't even give you the same doctor, and the doctor doesn't come in until the last minute. But you know, if I have these strangers coming in and checking my cervix, and this monitor's on me. I'm in this uncomfortable robe that I don't like. I'm laying down the entire time. I'm not allowed to move. This muscle ain't gonna be opening up. It talks about just how women need to be completely relaxed and happy, and how you can get to that point. So it talks about that. It talks about medicine, common methods of cervical ripening or induction, which I'm not going to be induced with anything whatsoever. When you are induced, it's not natural anymore. And I understand why women get epidurals when they're induced, because it's no longer just your body naturally opening up by itself and allowing the baby to come down. But when you're induced and you're given a medicine that's like forcing it open, I understand why you get the epidural. I completely understand. This book teaches you on the difference on Cytotec, which is an induction medicine that tells you what it is, what the side effects are. The FDA has approved it for ulcer prevention, but it is used in labor induction because there's a loophole in the FDA. So that's why it's used, and mainly it's because it's cheap. It's inexpensive for hospitals. They don't lose a lot of money, and they can give it to you. And there's side effects to these medicines, lady. You know, you should look into it. Different stories. I mean, it talks about the story of Ina May Gaskin and how she became the midwife of all midwives. And basically, this is a beautiful picture. I want to be her. That's how I want to be laboring. I want to be her. I don't want to be like those TV shows where you watch and the woman is in bed and she's like holding on to everything and she's like crying. And this is exactly how I want to be on the day of my baby's birth. Calm, collected, and I will be there. I will. But it talks about her story and how she became a midwife, and it's really interesting. It's a really interesting story. So this is the book that I would recommend out of all the books, and I think it's great. So hopefully you can get it. Pick it up, read it, and let me know what you think. Okay? Bye.